Questions come up all the time regarding what the process is to have surgery in the hospital. All of my high BMI or plus size body contouring procedures are performed in the hospital. So I'm just going to give a brief rundown of what it's like uh, to go into the hospital and what it takes to get you to the operating room. So my office has already scheduled everything with the hospital. They know what procedure you're having. They know everything about you. But once you get to the hospital, you'll get there early in the morning, usually about 2 hours before the case or an hour and a half before the case. And then you'll go into registration where they'll get your demographics and all your relevant information. They also have you go through the financials related to the procedure. And then a nurse, they'll take you to what we call the preoperative holding area, where you'll have a preoperative nurse who will take your history. And of course, they have all this information, but they go over it several times. You'll see not only the preoperative nurse, but you'll see the nurse anesthetist, you'll see the anesthesiologist. They'll ask you a bunch of questions. They'll start an IV, which will allow them to give you antibiotics before surgery and also the medications necessary to put you to sleep. They will put some boots around your legs to prevent blood clots, and they'll put all kinds of monitors just to see some of your vital signs before the surgery. And once you see all of the preoperative staff, you'll also meet my team, my circulating nurse, my anesthetist, and my anesthesiologist. And of course, you'll see me that morning where we'll go through everything again and we'll do some markings and just fill out some general paperwork and then just take you to the operating room. As you're wheeling into the operating room, usually they give you a little something to sedate you and just make you a little more relaxed. When you go into the operating room, it's kind of cold and you'll hear a lot of bells and whistles, a lot of monitors. They'll place, you'll see them getting ready to put you to sleep. That usually requires just putting an oxygen mask on, where they'll ask you to take some deep breaths. And again, you'll see a lot of people running around getting things prepared. But the idea is just to keep you relaxed and just so you know that it's a place that's kind of a sterile environment, which is certainly a good thing for what we need. And then they relax you, give you some medications, and put you to sleep. After they put you to sleep, they put a tube in your throat so the machine can breathe for you so you don't feel anything, you're completely out. And then we give you something, a device to put into your bladder to make you pee, or so we can know how much you're peeing during the surgery. And we prep you with all kinds of antiseptics, betadine usually, or something called ChloraPrep. And then we drape you up and get ready for the surgery. So the scrub tech has all the tools and instruments on the back table, which you may notice when you come in. But once we prep, then we go through a checklist to make sure that everybody knows exactly what we're doing and everybody's on the same page. And then we start our procedure. After our procedure, you'll go into what we call the recovery room, where you'll have a designated nurse that's going to follow your vital signs and make sure that everything's great after surgery. You may remember seeing me, maybe not. We afford you at that time, all the pain medicine. If you need pain medicine, medicine for nausea, if you have nausea. And after you're there in the recovery room for an hour, maybe an hour and a half, then you go to the surgical floor, which is where you'll be spending the night. And you'll, of course, have access to nursing care and medications and everything that you need after surgery. Of course, I check on you that evening, and then I see you in the hospital the next morning and plan for discharge.